Hello, good evening. I'm Andrew Penn. I'm a psychiatric nurse practitioner, and I'm a co-founder of the Organization of Psychedelic and Entheogenic Nurses, or Open Nurses. So welcome to our monthly psychedelic chat series. I'm really excited this evening to have Dr. Kwasi Adusei, who is a psychiatric nurse practitioner and the co-founder of the Psychedelic Society of Western New York, out of which he developed a grassroots psychedelic harm reduction organization called the Sanctuary Project with us tonight. Kwasi is a trainee of the MAP-sponsored MDMA-assisted psychotherapy for PTSD and was part of the first ever Therapists of Color cohort. Kwasi sits on boards for the Psychedelic Medical Association, the Source Research Foundation, and Reconsider. Currently, he works at Horizon Health Services, a Western New York-based nonprofit mental health organization, where he works as a psychiatric nurse practitioner in their substance use disorder detox, long-term rehabilitation, and outpatient centers. Kwasi hosts discussions and presentations on psychedelic medicine to reduce stigma among clinicians and providers working towards integration of psychedelic medicine in community mental health. So I'd like you to join me in welcoming Dr. Kwasi Adusei.
Hello.
Hey, Kwasi. Hey, thanks for being here tonight.
Absolutely.
Great to see you. So, we've been doing this series of interviews for almost a year now, and it's a lot of fun to get to meet people in the psychedelic nursing world. And we always like to start off by just asking how people got here. What was their trajectory? How did they find themselves in nursing? Nursing's interesting because there's so many different ways to get into this field. And how'd you get interested in psychedelics and psychedelic therapy?
Yeah. So it's really good to be here, first off. I mean, I'm always really just inspired to see this conversation around psychedelics happening within the field of nursing. It's something that I never really expected would grow to the extent that it has. So just thank you for holding the space. I have nursing in my blood. And so you might hear that often for a lot of nurses, So my mother is a nurse. I mean, my mother had a really interesting experience. So when she came here from Ghana in West Africa, she started off as a home health aide, and then she became a CNA, and then she got her LPN, and then she got her RN, and then she got her BSN, and then she got her master's, and then she got her DNP. And I watched her go through that whole process, raising us kids. And so for many of us, we were all really inspired by her. And so I have two other sisters who are also nurses. One is got her master's in teaching. It's a big medical family. My father was a respiratory therapist. I have another sister who's a physician's assistant, and then a sister who's studying neuropsychology at Columbia right now. So it's a big family of folks in the medical field. And so for me, I initially I went to university for pharmacy. And so that was the original intention. But I'd always had a really big interest in psychology. Since I was 12, I think I wanted to be a psychologist. I knew that that's the direction that I wanted to go. And when I got to college, and I decided to end up doing pharmacy, the process of learning about science really got me excited. I loved physio, and I loved anatomy, and I loved I loved all of these so much, but I also loved that sort of like soft human side, sort of right-brained approach. And then I learned, that there was the psych nurse practitioner, and it seemed like this beautiful way to bridge the two. And so as probably a freshman, when I started getting really interested in psychedelic medicine, and immediately recognized that, nursing would end up being that path for me. And it was at a time when I think the conversation around psychedelics wasn't as robust as it is today. And it's grown quite a bit, but I ultimately saw this opportunity to not only do the prescribing, but also be hands-on, and, was so inspired by, of course, what I watched my mother sort of go through to be the person that she is. And it became a fusion of my experiences ultimately to pursue nursing and then get engaged with the psychedelic world. So that's mostly about the psychedelic piece, rather the nursing piece. On the psychedelic piece, yeah, I mean, I think very early on, as I mentioned, as a freshman, I recognized the power that psychedelics would have for mental health treatment. And the way that I ended up getting involved or getting connected with the world of psychedelic medicine was through MAPS, so Multidisciplinary Association for Psychedelic Studies. At the time, they were doing the global psychedelic dinners. I'm sure you remember. Yeah.
I hosted one. Yeah.
Did you? Awesome.
I did.
So that was how I got sort of, I saw that they were doing that. I saw it as an opportunity to connect with other people. Being in Buffalo, there weren't a whole lot of people that I think were having conversations about psychedelic medicine. And so, did this fundraiser with a few people who kind of came out of the woodworks, super excited, as excited as I was. And, we raised, something like $700 from it, and decided, there's enough people who are interested in this. Let's get started with somewhat of a psychedelic society, which we'd heard at the time there was something happening in Brooklyn and in San Francisco. I was like, yeah, let's do something in Buffalo. So
nice.
We kind of came together and started a psychedelic society, basically a community-based organization to do a lot of good work. So
changing the world over a dinner table. I love it. Food and friends changing the world.
Yeah, absolutely.
Yeah, and your mom must be so proud, right, to have made that kind of example for all of you, and then to see where that led her kids.
Yeah, absolutely. Yeah. So she I always see the twinkle in her eye, to see. So I'm one of 8. I have a big family, so I have a couple of siblings who are still in Ghana, but yeah, I grew up with quite a few siblings. And so I think all of the work, all of that hard work that both her and my father did to get here to this country, to support us, while going through school, to see us be successful now, I'm sure really lights her up. And it's been interesting too, because she's fully aware of the psychedelic work that's going on. And it's been an interesting process of trying to sort of break her over the bridge, if you will, of getting a better understanding of exactly what it is that I'm working towards. And so nonetheless, I think she's been really proud to see a lot of the success that's come from engaging within the field of nursing, and of course getting the doctor of nursing practice. And it's been really great.
Yeah. How old were you when you came over to this country?
So I came in 96. I was about 5 years old. And, I just actually returned not too long ago. So it was only a couple of years ago that I finally had, 2019, that I had an opportunity to go back. And it was for a medical mission. So we went back and spent a fair bit of time offering care to quite a few people. There was this island of about 50,000 people. It was the size of the island, maybe 3 schools on the entire, for all 50,000 on this sort of like island. Very literally no access to healthcare. So it was really wonderful to get over there and be able to offer that kind of work and medicine. And for me to, I guess, reconnect with my roots, reconnect with my ancestry. I mean, I think in my psychedelic sort of like navigation, it's been something that's helped with learning and understanding more about myself, connection to nature, connection to spirit. And so, my trip back to Ghana ended up being a really wonderful, surprising in a lot of ways, but also just exactly what I think I needed. So
nice. And I think about your mom's course as one of the things that's nice about nursing is that you can go through it in this very incremental way if that's what life will allow you to do. That she literally worked her way up through the steps over the
Absolutely.
years. That's great.
Yeah. So and nursing, and I think is many Ghanaians, so us folks, it's a big profession. I mean, really, it's a big profession everywhere, but I do find that a lot of Ghanaians find their way to nursing.
Yeah, no, that's great. Well, so kind of pivoting to this question about what do you think that nurses bring that's different to psychedelic therapy? Do you think they have a different perspective on this work than some of our colleagues that are trained in other professions?
Yeah. So what I'll share is a bit of a story for some of the work that I was doing with other community members around psychedelic harm reduction. So at the time when I was helping to get this organized, essentially we, amongst all of us, really wanted to be psychedelic therapists in the future. So learned of the Zendo project and was so excited about that work, and saw it as this avenue to, in an above ground way, hold space, and see what sort of it's like, kind of like being in an emergency room before getting into the ICU or a different sort of like more settled environment. And so the festival environment seemed to be the place where, of course, most psychedelics were being used there. And the Zendo project just seemed to be very inaccessible. So for folks who aren't aware of the Zendo project, they offered psychedelic harm reduction at these major music festivals, Burning Man, Lightning in a Bottle. And so it was like amazing work, what they were doing, but many of us just didn't have the resources to find a way to volunteer. So we thought we would just do it ourselves. We would just kind of develop something here locally. And we spent some time learning more about what Zendo was doing, what their process was, and eventually started getting out and offering that space for people. And at the time, I was a nurse. I was working as an oncology nurse. And so I worked night shift and overnight, holding that space for people, going through some of the most difficult experiences of their lives, holding that space for their families, for people who were close to them, like bearing witness to people who were leaving this realm, going into the soul plane. It was a really interesting experience that I didn't recognize until hindsight related so closely to the work that we were doing, offering psychedelic harm reduction. And I recognized that the only reason why we were able to hold that space for people was because of this level of comfort that I already had holding that kind of space for people in nursing, bearing witness, being comfortable enough to hold somebody and walk somebody to the bathroom and change somebody if it's necessary, all of these things that might come up in psychedelic experiences.
Totally.
To really care for somebody, fully care for somebody who's in a very vulnerable space, and to be able to sit with and be non-directive ultimately, right? And so to be present for whatever experience is unfolding. All of those things are so inherent to the work that we do as nurses. It ended up being a very, very natural progression into offering that kind of medicine and psychedelic harm reduction. And I get very excited to think about all of the future nurses who might be getting engaged with this field.
Yeah, that's definitely something we found in starting this organization. There's sort of it's like there's a parallel evolution where lots of people were having the same idea all at the same time, but didn't know the other people that were having the same idea. And it's been really fun to sort of serve as this conduit for people to connect to each other, to other nurses who are interested in this. I mean, could you say more about, so your experience with people who are dying, people who are really sick and dying, to be in that kind of liminal place between this realm and the next, and how that is similar to working with psychedelic spaces, because as some of the early work in this was with people who were quite ill, who were dying. The NYU study, the Hopkins study, but before that, there's the apocryphal story of Aldous Huxley going out on 200 mics of LSD from his laryngeal cancer. There's a history of this, this transitional space. So I'd love to hear more of your thoughts of how that work informs your psychedelic work now.
Yeah. So, I think death is interesting in that, of course, there's a stigma around death too, right? There's almost like there's a fear of death that we have inherently. And I've always found it to be interesting because it's a part of everybody's experience. Anything that lives dies. And nonetheless, there's a discomfort, there's this energy around death and dying that is like, there's a repulsion almost. And I see it pretty much as another sort of plane, right? So like moving from one plane to another, just in the same way that birth happens. And what we see when people are coming into the world is surrounded by family, surrounded by celebration. And I always wondered why we couldn't bring elements of that to the dying process, where there could be a celebration of somebody's life, and a more positive viewpoint or experience of sitting with that process, which we know is happening. And working in the so it was a bone marrow transplant unit where I worked, and so many of the people who were getting bone marrow transplants, it was pretty much a rescue procedure. So they anticipated maybe 5 years, depending on what the specific cancer was, for life. And so my father ended up getting multiple myeloma, and he himself required a bone marrow transplant. And so I went through this parallel experience of watching my father go through this, and seeing his dying process, and then also being in the hospital setting and seeing the dying process of the patients, the people who I was sitting with. And they just gave me this really interesting experience with death and dying, where I was really curious about it, and it was changing almost, for me and my father, it was really changing our relationship, right? Like that, once you know that the end is coming, it really does something to the energy, the experience that you might have with somebody. And so with my father in particular, we didn't have a very, very close relationship. But when we learned of him passing, or rather we learned of the multiple myeloma, and for me working in the field, I kind of understood exactly what the course would be. And it brought me really close to him. And so in that time that we had remaining, it was like a change in our relationship. And so once he actually did pass, it's interesting because I feel often that our relationship really began after he passed. And I've come to feel even more closely connected to him since his passing. And so as that experience was happening, while I was also in the hospital setting and watching people's experiences unfolded, I think it really allowed me to sit with the folks who were going through that and their families, and understanding what the experience is like, the confusion, the grief, and the way that it shows up for people in so many different ways. And being able to turn into it rather than away from it. And so what I would find often is there were few people who would sit with the patients and talk to them about what their experience is like with dying, how it's landing for them, how they're relating to it, how they're relating to it in the context of family, how they're relating to it in the context of their stories. One of the things that I find interesting is any book that you read, the way that the book ends always, has an effect on how the entire story was written. And so how do we generate this element around death and dying where we can have it sort of enveloped in this love that can help with allowing that full story to sort of exist within the context of the way that it ended, right? In the same way that ideally it began, which is surrounded by celebration and love and appreciation. So the time that I spent on the floors with a lot of the patients there, I think really helped change, or rather than change, but evolve my experience and my relationship to death and dying.
Well, I'm reminded of that old saying that we die as we lived, and that my grandmother, who died earlier this year, would have been 100 years old today.
Wow.
She would have been, today would have been her 100th birthday, and she was a fierce old Scot, and she lived in her own house until the day she collapsed and had to go to the hospital, and she died 3 days later. So she just lived and died on her own terms. And I just think, she died like the way she lived. It's like, no, I'm not going to drag this out. I'm not going to fuss, and I'm thinking about the way that you had those really courageous conversations with people, because, it's a lot easier to just say, well, let's get you some more morphine and maybe go to sleep for a little while. And, before you want to talk about this, will be the next shift and I'll be home. But to do what you did, what you described there, and to work with psychedelics, I think really requires a lot of courage.
Yeah. So this is somewhat of an aside. You mentioned your grandmother. So my grandmother, when I went to Ghana, I had an opportunity to visit her. So, but prior to my dad passing, he was building a school. I learned he was building a school in his old town where he grew up. And so my aunt was taking me to the school. We went and we were going to visit my grandmother, who we learned once we got to the village that she had just gone to the hospital that morning. So of course we went straight to the hospital to see her and be with her. And I held her hand and I just thanked her for, I wouldn't exist without her, essentially. And so 30 minutes later, within 40 minutes, she had passed away.
Wow. And you were there, you could be there.
Yeah. So, we had spent a fair bit of time with her, and my aunt and I, we were going and visiting different family members. And by the time we had gotten to our next family member, another aunt, she was on the phone and said your grandmother had just passed, and it was within 40 minutes. So the following day we went back to the town to just kind of grieve together with the rest of the family there. So I find the experiences that I've had that feel mystical almost, you get the sense that it's not quite coincidental.
Yeah.
And I think that psychedelic medicine really brings that energy into so much of what we do, in a way that it connects us to a greater sense of being, a different sort of level of connection with the rest of the world, with nature, with each other, to really feel that web of being, and see how things are fully connected.
Yeah, they're like synchronicity magnets. Like, well, this is all really interesting how this is all happening now.
Totally. So, and then, to comment on the question, I think what really helped me a lot with having those conversations with people was an element of mindfulness, to be able to practice mindfulness in every moment. And I'm in and out of practice with it,
You and me both.
Yeah. And at the time when I was there, it felt so important for me to be in practice. It just changed the way that I was able to show up for my patients. And I think I credit psychedelics to so much of that.
I'm wondering what other advice, aside from courage. I always love the word courage because I was reminded some time ago that it comes from the French word for heart. Like we think about like cor pulmonale or coronary, it means heart, right? So, to be courageous is to come from one's heart. And I think nurses, we've certainly seen that on display this year, of the courage that nurses have in just their day-to-day work. And you're talking about a kind of courage of like really showing up authentically for your patients and being willing to have, you're like a permissionary. You gave people permission to have those uncomfortable conversations, or maybe frightening conversations as they were ending towards the end of their lives. And I mean, that's such a huge gift. And I think we do that a lot in psychedelics too, where we give people permission to feel whatever they're feeling.
Absolutely.
Even if it's messy or inconvenient or, unwanted, what have you. I'm wondering, what other advice would you have for nurses who are interested in working with psychedelics? I mean, I think you probably get messages like this all the time, like we do, of, hey, I'm a nurse, I just heard about this, I'm really interested, I want to maybe make a change. What should I be doing to get ready for this? What would you say?
So, one thing that I'll share is, for me too, I'm very new I graduated from nursing school 2015, and then 2019 as a psych nurse practitioner. So I haven't been practicing as a psych nurse practitioner for very long, and just in the involvement and the energy and the passion for psychedelic medicine, have been able to find myself connected with quite a few opportunities for practicing psychedelic therapy. So I'm in training, I'm in the training process in many ways. And I think often, because nursing isn't directly tied to therapy in the way that we think of psychedelic therapy, it's not as prevalent to see yourself as being able to hold that space, but I think that's changing.
Right.
I just had a conversation yesterday with one of the nurse practitioners who's in training right now at our organization, who just called me so excited to learn that I was doing some work in the psychedelic space. And so she's been a women's health nurse practitioner for quite some time, and has sort of pivoted into the psychiatric space because of an energy to connect with psychedelic medicine. So for the folks out there who are wanting to get involved in nursing, I mean, keep asking the questions, network as much as possible. Depending on where you are, there are many psychedelic societies that exist locally, and there are opportunities to sort of connect with communities where you might be. Look at the training programs that are near you. I think ketamine-assisted psychotherapy training programs are wonderful. Nurse practitioners right now are able to, of course, prescribe ketamine, and is a really wonderful medicine for so many people, and is showing some results in substance use disorders and trauma, right? And so that's something that people have access to be able to hold that space and to be able to prescribe even. And so there are so many different ways now to get engaged. I think also there are the ways to get engaged professionally, and of course we're waiting on some FDA approvals for many of the medicines, but there are other ways too, I think, coming from the harm reduction space or the risk reduction space. I see that as a huge opportunity, a huge space for people to be engaged with this work. And so I'll plug the Fireside Project, who many people know now, but offering that sort of psychedelic risk reduction in a totally different way. And so if it's something that you're, as a nurse, wanting to get involved with, that is an opportunity too to connect with the Fireside Project that does, it's a call service essentially for people having difficult psychedelic experiences. And so there are those opportunities to get this experience even prior to, the FDA approval. Once I think COVID sort of settles down, getting engaged with Zendo even, or other psychedelic harm reduction or risk reduction programs ends up being wonderful. Also, one of the things that I think is important for nurses is we're educators. It's part of our profession. It's part of who we are. And how do we take that piece of us, that educator part of us, and we apply it to psychedelic medicine, this thing that we're super excited for learning about? And how do we take that and then start sharing it with our colleagues? How do we take it and start sharing with our families, our friends? How do we build communities around the sharing, the knowledge exchange? Because we're prepared for that. That's something that we can do right now, and it's something that's not gonna, there's gonna be more and more of a need for. So of course, nurses in a hospital setting really being the largest workforce there. I anticipate that as more nurses are finding themselves drawn to psychedelic therapies, it won't take very long before the psychedelic realm is also quite robust with folks with nursing backgrounds. So, it's a great opportunity to start asking questions, start networking, connecting with community organizations, connecting with online communities and organizations, finding ways that you can get involved in harm reduction capacities, finding ways that you can share your knowledge and your excitement and your energy and your information with the people who are around you. I think what more and more people are experiencing is, as they share their enthusiasm for psychedelic medicine, rather than being pushed away, there's an element of curiosity that people have now. There's a different zeitgeist, right? So people are curious, they're intrigued by it if they don't know very much, and if they do, they're extremely excited, right? So if you have a concern, if you have a fear that in my workplace I can't talk about this because I'm worried about how people might look at me, know that there's a shift, there's a change. For me and my organization, I felt really compelled to fight against that stigma and talk about psychedelics and do some myth busting for MDMA therapy, and particularly a couple of the environments in which I'm in, primarily substance use disorder treatment. And so there's like a double level of stigma there. And nonetheless, I've had these conversations with people in those environments, and there's an openness, right? Of course there's a fear, but you meet that fear, you acknowledge that fear, you know that fear is going to be there. But also there's like an openness to to learn more, to have some of your misconceptions sort of dispelled, right? And so people are really looking forward to the folks out there who can be champions within their communities, within their workplaces for this medicine.
Yeah. I personally, I'm thrilled that you're early in your career. So we recently found out that we share the same birthday, which is really cool. But I do suspect that I am a few years older than you. And so I'm so excited that you have, 40 years of career ahead of you. I think that's so exciting to just know that you're going to, that you're already rocking at this early on is amazing. And I love that you also talked about the sort of internalized stigma that a lot of us have around this topic or have had because of the way we all got acculturated around substance use. That all drugs were kind of equivalents. They were all bad and they all had bad outcomes, and that there was no difference between them, and that really what this is pushing is a much greater appreciation and nuance for these different things. I wanted to ask you, you've done a lot of really important work. It's well known that the psychedelic field has historically been a pretty white place. That there hasn't been a lot of representation from BIPOC communities, and that people like Monica Williams have done a lot of really important work in highlighting that. And I know you've talked about some reasons why that historically may have been, and how we can begin to become more inclusive. And so I would love to hear more about that kind of work that you've been doing around increasing inclusivity and equity within the psychedelic space.
Yeah. So, one thing that I'll clarify is I'm as much in the space of curiosity as anybody, right? These are all of the same questions that I'm asking about mental health, period. Right. Yeah. So beyond psychedelics, how do we get folks to think about mental health in a different way? How do we break through stigmas for folks who don't see mental health? So there are so many people who I meet just as a psych nurse practitioner, many of my patients who come from sort of ethnic backgrounds or minority backgrounds, and then myself included, having been a patient of the mental health system at some point, where there's you don't quite see mental health as being something that exists. I can go back to Ghana. And in Ghana, a lot of the mental health, the things that we might call mental health disturbances aren't looked at as mental. It could be either you're possessed by the devil. I think in Ghana, the whole country has maybe 3 psychiatrists or something to that effect, right? And so, there's a very different experience around mental health and a lot of thinking of global populations. And it makes sense, right? When we think about the development of mental health and mental health treatment, it comes from sort of like a Eurocentric, like research-driven perspective. And so there are other ways for healing that I think a lot of communities of color have access to. And the church ends up being one of them. That's huge, and spirit being one of them. And so it's not uncommon that within the mental health realm in general, that there's sort of less engagement with mental health than you might see in more white populations. And so that ends up being, of course, something that translates over into the psychedelic realm too, with additional layers of stigma. And so for me, I'm asking a lot of these same questions, and I'm wanting to figure out how we can sort of solve for some of these things, and doing a lot of research and learning a lot from people who have been doing some really amazing work. Monica Williams, of course, being one of those. I think the work that MAPS is doing in particular is really amazing. And so they have this intention to raise about $5 million towards their health equity plan that allows for training, for community engagement, that is going to help with bringing more clinicians of color into this space, having more people who look like the patients, that have an element of trust in some of the communities in which they're coming from, that can communicate with the same language, that can show that one of the things that I always think is funny is in a lot of communities of color, when you talk about psychedelics, they might be called white people drugs, quote unquote, is the way that they're described. because you often don't see psychedelics as being something that is for your race, you know? And so growing up in the Bronx, we always looked at like things like LSD and psilocybin. We heard that, and it's like, yeah, those are like, we don't do that, you know? We smoke marijuana, we smoke cannabis, and right. So you have these sort of associations with different substances with different races, right?
Right.
And so I think it makes a lot of sense, right? There's I have a colleague friend Joseph McCollin, who calls it this trifecta of stigma. And so you have this stigma in mental health, and then you have sort of a stigma with drugs in general, and then you have a stigma with research, right, within communities of color. And so between the three of these, it gets really difficult to engage communities of color, to include them in the research. And it's not enough to just do the same sort of advertising or marketing in order to sort of like get participants. It takes really tailored and specifically focused recruitment efforts to be able to get more people of color in the studies, but not just getting them into the studies, but how do you then hold that space for them to feel comfortable throughout the study?
Right.
Like, what does your environment look like? What's the study room look like? You know, when Monica Williams and her team did a lot of the work that they did at UConn, they learned they had to like totally rework everything. That a lot of people of color needed more time in the preparation, as an example, than standard, because you have so much more to work through, including a lot of that stigma. And so there are so many different layers to this, how to bring in and usher different element of inclusion in the space. But I get really excited of all of the folks out there who are working towards it. And so I think often about the curb cut effect, which is something so the curb cut, I was introduced to this through that MAPS equity plan. They put out this beautiful bulletin. And so the curb cut effect essentially comes out of a pool of students from Berkeley who, you know, there were folks who were riding wheelchairs and had a really hard time getting from class to class. And so they really wanted to cut the curbs.
The little ramp at a corner or something.
Yeah, exactly.
Okay. Yeah.
And so they pushed and were able to eventually get the resources to cut these curbs, and it benefited not only the people who were using wheelchairs, but it benefited moms with their strollers. It benefited construction workers who were, you know, wheeling in and out sort of like materials. And so the whole idea of the curb cut effect is, if you design programs for the populations of highest need, it benefits everybody. It benefits all of us. You know, we look at the GI Bill as a really great example of how something that was meant for the veterans to give them better access to education, give them better access to low mortgage rates, that, you know, it produced a wealth of so many amazing people that really transformed American society in a lot of different ways. And I think the GI Bill has its own sort of things. It wasn't, you know, as equitable as it could have been, but nonetheless, I think the model holds that the people who are making efforts towards making things more accessible for specific populations, making things making things more accessible for specific populations changes it for literally everybody. And so we think about with the psychedelic research, how do we hold this space that makes people feel more comfortable for people of color? How do we make the therapy more affordable for people of color? Really, we're asking about how we make the psychedelic therapy safer. How do we make psychedelic therapy more accessible? Period. Right? So I think that there's a lot of excitement around what's happening in solving or finding answers to that. And it's coming from all of these different levels. I mean, from the community space, there are a lot of folks out there like the Ancestor Project and Food and Bodies Collective that are doing really great things for communities of color. There are, of course, the training programs like MAPS, which is doing really great things, and many others that are offering scholarships for people of color to get engaged in this work. And of course, like the research efforts to be able to include more people of color in many of these projects that I think collectively is going to allow us to work towards a greater good for not only people of color, but really for all of us.
Yeah, absolutely. And I was thinking back to something you were saying earlier about your clinical work and having to have the courage to have those uncomfortable conversations with somebody a patient who's, and I think about in our community as a psychedelic community, if there's, if we, this is a community that can tolerate a certain amount of discomfort. Because, if you've ever had a difficult psychedelic experience, how uncomfortable you can get, and so can we extend some of that same courage and that same willingness to be uncomfortable to these really essential conversations that need to happen in the community? And for somebody like myself who's a white guy, can I bear the discomfort of getting it wrong sometimes, and being appropriately corrected, and that's important. We have to, if we can go deep on other places, I hope we can extend that same skill to go deep here.
Totally agree. Yeah.
Could you share a little more of what because I think, I think most of us have this kind of idea of what a psychedelic study looks like. You got the soft furniture, the two therapists, some vague colorful print in the background. What sort of things besides more time for preparation were needed to allow for people of color to feel more comfortable in that setting? Because I think as we have more of these kind of studies and eventually more clinics, like, that's really important knowledge to have out in the world.
So, I think one of the big things is having clinicians who look like them, that immediately when you and so there's a points of clarification here too. So when you have a clinician who looks like you, one, there's this sort of like shared and mutual understanding that there are some things that I don't have to explain.
Yeah.
That I imagine have very similar experiences in some ways. And also, I think it's important to acknowledge that not all people of color are sort of this like monoculture, and that, somebody who looks like me, maybe even has the same name as me, has the same dress, the same face, the same hair, could be a very totally different person who has totally different needs and totally different experiences.
Right.
And so how do we hold both of those elements, right? How do we hold some of the things that we know to be truth, which is that we're all very different and unique individuals, and also that we, in many cases, share a lot of qualities and share a lot of needs. And so I think you can work towards both of those things. One, by having a more diverse pool of clinicians, of course, which is, I think, happening more and more. So the most recent MAPS therapy cohort, I was supporting as like a co-lead for one of the groups. So what I was amazed to learn was almost a third of the trainees were of color. And so this is the beginnings of seeing a more diverse pool of people who can sort of step in and be psychedelic clinicians for research and for therapy following FDA approvals. And so there's having sort of like that a more diverse pool of individuals, but then also we always talk about like set and setting, right? And so the setting is a part of it. So what kind of images are you having around, and in having some sort of like pictures or frames or models or whatever it might be, asking the question, am I appropriating this? Right? Like, I might have like an symbol hanging in my room, or I might have something of an Asian influence kind of around, because I think mindfulness, there's a huge element of mindfulness that comes from Asian culture, and so often we leave that part of it out when we talk about some of these things. And so asking that question, am I appropriating? What kind of relationship might I have to some of the things that I might be displaying in a room, but also being cognizant of like, I want to make the setting also comfortable for you, and also represent things that you're going to connect to in your experience. And so I think ultimately a lot of it comes down to being able to have like a conversation with somebody and ask like, what are your needs? What's going to be comfortable for you? What do you want in your altar? Right. What are the things that are a part? So, the DSM has something that the cultural formulation questions, and essentially it's like a guideline of questions that you can ask to better understand your patient from a cultural framework. And I think so many of these elements could be applied in the assessment of psychedelic therapy. And so it's asking what your relationship is to your culture.
Right.
What are the things that allow you to heal? What are the things that make things worse? Like, what does your community, or rather, how would you say your community perceives the experience that you might be going through? If you're experiencing trauma or anxiety or depression, learning about what it means to experience trauma, right? What does your community, how do they make sense of that, right? And so in doing all of these, asking these questions, you're getting a better idea of how do I personalize, right, my approach to somebody. Also having, and so you made a really great point earlier talking about this element that the psychedelic space, we're good at difficult, like sitting with difficult things. And so these conversations end up being difficult things that we need to sit with. And I think it requires a lot of compassion from all of us. To know that we're all sort of learning in this process. I think me as like a Black male, I have a lot to learn myself, and that my race is not a proxy for my knowledge, right? And so I think we all have like a lot to learn, and in doing so requires a whole lot of compassion from all of us, because really a lot of the psychedelic work, in the way that we've been approaching it, is very new, and it's been going on for like the psychedelic medicine is for so long, for thousands of years. Psychedelic medicine has existed in a different context. And so now we're applying these sort of like sacred medicines into the Western model of care that we might have. And I think in the process of doing that, we're going to trip, and we're going to need to ask questions, or we're going to have to, you know, look up the FAQ and realize that there is none, and that we're learning, you know, we're learning this kind of as we go along. But I think that we have an opportunity to sort of like hold each other in the process of doing that, because again, we're trying to do this for everybody, right? And asking those deep questions for access and equity.
Well, and I love that sort of spirit of humility that you come to this with. You know, it's not, it's an interesting paradox, but of course, you know, in psychedelics, we're comfortable with paradox, or we try to be. You know, that we have to be both courageous and humble at the same time. And that I love that what you're describing is really not presuming that we know what a patient needs, but rather asking them to, you know, I love what Gene Watson talks about this, about like we co-create between nurse and patient the space of healing. And so in order for me to help, for us to create that together, I need to know a lot about you, and I can't assume I know about you. So it's this, and it really feels like this bottom up kind of thing that you were describing, you know, kind of like the curb cut, you know, the curb cut when we had trickle down economics, and that was crap, right? You know, but this is like coming from the bottom up, it's grassroots, you know, and then it has this widespread effect. But if we start with this, you know, teach me about you. I want to understand about you and your life. And then we can create this space together in a way that's going to be most comfortable for you to be in it, rather than assuming I know, you know, which is exactly what I hear you describing. And having the courage to screw up, right? Like, we're going to make mistakes, you know, we're going to fumble sometimes. And that's what I really hear you saying, is that, you know, it's okay to make some missteps, as long as we recognize them and try and make it as right as we can.
And learn from them.
Yeah, exactly.
And learn from other people's mistakes too. I think that's an important piece. You know, I think one of the pieces that comes up a lot in psychedelic medicine is it's almost this sort of mantra of like taking it slow, you know, you know, asking sort of what the medicine wants, and knowing that, you know, you have to sort of take your time with something, and we can't forget that. You know, that is something that we cannot forget. And also we, you know, it's become such a mantra and we hear it so often, but like how do we really allow that to be embodied? And how do we allow that to be something that we like really honor deeply, to take things slowly? Because and we talk about risk reduction all of the time, right? And one of the mantras within the risk reduction sort of realm is start low and go slow, right? So how do we apply that same sort of element to some of the psychedelic work? But of course, there are some pushes and some things that are like driving movement, and there's an element around it that I think is like great. So it's like this sort of push and pull that we might have, right? And it's necessary. It's totally necessary. You know, it's something that it creates a sense of balance ultimately. But we do have to remember at some points to just like sort of like slow down. And so I think in the process of asking questions, it forces you to, right?
Yeah.
So
yeah, time dilation. We're just gonna sit here for a while, and we've got no place to go. We don't have to be anywhere today. Yeah, I'm wondering, since you talked a little bit about some of your training, if there are, for those nurses who are early in this process or maybe just learning about this, what sort of trainings, and that could be as specific places you suggest taking classes, or could be practices, personal practices. I mean, what sort of things do you think are helpful pieces in the sort of portfolio, if you will, of a psychedelic nurse?
So, as far as some specific things, this actually next week I'm going to be heading out to Colorado for training with Pratty for ketamine assisted psychotherapy. And part of the preparation for that is like a daily journaling practice. And so I am a big compassion journaler. I find it to be an interesting way for me to rewire my brain. So often I think humans have a negativity bias. We tend to lean towards sort of like a pessimistic attitude generally.
That's not just me.
Right? It's automatic, right? These automatic negative thoughts. There's, I've heard them described as like ants, right? That fester your brain. And so part of the rewiring of that and making it more intentional rather than automatic is writing, because as you're writing, you have the opportunity to be intentional. And so, I have a journaling practice where I write very intentionally, self-compassionately, in a way that I probably don't think very automatically. I find that to be such a, helpful practice, for, I don't know. I've really connected with the world and the practice of self-compassion. But additionally, I would say it's always important to find something that's really embodied, right? Like having a physical practice, and that might look differently for lots of people. I know yoga is something that's really helpful for a lot of people. For me, interestingly, it's rock climbing. So I do a lot of rock climbing, and that's kind of where I get in touch and in tune with my body. And in many of my meditation practices too, like the rock climbing itself is a meditative practice for me, along with additional. So, even right before coming here, a long day with patients and just settled in for a yoga nidra practice that helped to sort of settle my body. So all of these like self-care practices that we might have, are so important for nurses, where when I was working on the floors, I had a very difficult time taking care of myself. One, working overnights, I wasn't sleeping very well. I wasn't eating very well. It's almost part of the, like burnout. I think it ends up being just kind of part of the job. And much of it just comes from the structure in which we exist in, the systems that sort of drive some of the workflows that many people have. And so having these sort of self-care practices are so important and elemental to being able to, as then getting into doing care for other people. I mean, it's how you show up with integrity, right? It's a lot of the things that you're sharing with people that you're doing that for yourself. And it's difficult, right? And I have a hard time doing it sometimes, and I'm in and out of practice all the time, but it's a process, right? Just continuing to work towards and learn and practice. And so, Pratty is something that I'm going to be exploring. I think that the folks who are working on this on Pratty are just wonderful human beings and very intentional, and really emphasize this element of connecting to the sacred. And I think that is such an important piece that we can't really forget about in the psychedelic space. So MAPS, I have nothing but great things to say about the work that MAPS is doing, and the intention and what they've done for the ethos in general, but also the elements of raising the question around diversity and equity as much as they have, I think is really wonderful. And CIS, I've had some, or the CPTR program in California. I had the pleasure of meeting some of the folks there and meeting some of the students there, and they have a really wonderful program. So, I mean, there's so many great programs out there. And so it doesn't take very long to find something that might seem accessible for you, right? In cost, in region. So I would also, and this might have come up before, considering this is open nurses, but Nurses in Sacred Medicine. So program that Stephanie Hope is working on, in New York, I think is absolutely amazing and wonderful. And it's something that people should definitely Stephanie's such a wonderful human being.
She's on our wish list of people that we want to get on this channel. So
absolutely. I mean, I think that I often direct people to that program if there are nurses that are interested in it. It's like, let's start here, because I think the part of all of this is connecting with other nurses, right? It's connecting with other people who are along the same path, and supporting each other through that path. And so like finding the others in this element, right, I think ends up being really helpful. And so that's one of the things that I see open nurses doing, is helping us find the others. And it's such a crucial element to being able to move forward, because it's a new field. And so the connections that you're making are going to end up, making a really big impact, and some of the opportunities that you might get to do therapy as people opening in practices, or people are needing help and support in some of the work that they're doing. So meet people, meet other nurses, check out some of the training programs that might have like a nursing specific focus, stay engaged with some of the nursing communities that are talking about psychedelics, and see how we can sort of be that bridge in the way that we have been in the medical field in general.
Absolutely. Put a plug in for our Facebook page. Our Facebook page too, if that's really probably the most interactive place that we have on Open Nurses right now. So Kwasi, I want to just pivot a little bit, and we've had a pretty shiny conversation about about psychedelic nursing. Do you think there's any downsides or risks or challenges? This is coming from our Facebook page. Question about mainstreaming psychedelics. Are we gonna? Is there gonna be a downside to this?
So I would say that there are perils to everything, and often it's the. So one of the things that I had a really interesting experience with psychedelic medicine, with ayahuasca in particular, was having this sort of relationship built between joy and pain, right? So these dualities that we experience, that in many ways I almost don't see them as separate, and I started calling it Jane, right? And so that it's such a critical element to life in general, is that there's always going to be the good and the bad. And so I think with as much power that psychedelics have to transform the individual, to reconnect to the community, to reconnect to the sacred, to reconnect to the planet, I think there's also a lot of harm, right, in equal magnitude that's possible too. And so that's where it, like, that taking things slow ends up being really important, because the holding people's spirits is no joke, right? Like holding people's souls and experiences and their traumas is serious business.
Agreed.
So, we have a large sort of underground network of people who are doing medicine work, and there are a lot of people who benefit greatly from it, and there are a lot of people who are harmed in that process too, that we don't always quite hear about. And part of it is because we don't always have the same level of preparation that's necessary. We don't have the same level of integration that's necessary. So much of the psychedelic experience, what I've experienced is, the psychedelic experience might really be the beginning of a chapter, like literally the first page of the chapter, right? It's the rest of the chapter is all of that time that you're not actually in that psychedelic space, right? That's where the story is truly unfolding. And so the more that we can really come into recognition of that, I think the safer that we can sort of get with some of the psychedelic work that's happening. But 100%, I anticipate that bad things are going to happen, and it's unfortunate, and it's also the reality. And so we really have to do everything that we can to be preventative, learn from the mistakes of the past, like actually listen to it, take them as cautionary tales, whatever, right? Because it's such a sensitive space. There's so many abuses that are possible. It really opens people up to so much that if we're not careful, I mean, people's lives are ultimately at risk here. So
yeah, and I love that appreciation for giving things time. I think about midwifery and how much midwifery is often about letting things unfold. You can't make a flower bloom faster than it's going to bloom. You have to. It will do its thing if you let it do its thing. And I love this idea of actually just taking a breath and maybe waiting an extra beat, because we're so impatient, right? We've been waiting for this forever, and now it feels so close. It's like tantalizingly close. Rick Doblin talks about 2023 for MDMA, and we're getting closer to phase 3 for psilocybin, and it's like, when is this going to happen? And I love this idea that, like, what you're saying, it's a long life.
And I also, and just to add a brief point to that too, I mean, when we think about just healthcare in general, when we think about the mental health system in general, for these well-established systems, there's always harm, right? We talk about nosocomial, like like the things that happen as a function of the hospital setting. I mean, that harm is just sort of built into so many of these care practices. And so, so I think psychedelics are really just another sort of platform in which that might happen. So there's an element I think it's interesting because we always talk about psychedelics as tools. And I always like flipping that on its head. I like to think that we're the tools and we have to acknowledge that. And so psychedelics maybe are using us. But also, I think it's like perhaps this bi-directional relationship that we're developing, right? And so we have to develop a relationship, and so that and the development of a relationship with plant medicines and psychedelics, I think, with that mindset, that mind frame, can help to, of course, minimize some of the risks that are associated with psychedelics and its mainstreaming.
Yeah. All right, one last question before I let you go. So we tend to end. Oh, we got 2 more questions. All right. Damali Robinson wants to know, do you think that this could be incorporated into clinical rotations for studying for students in PsychNP programs?
So I think that is a long-term view, and I don't see why that wouldn't be possible down the line, right? So I think one of the things that I'd love to start seeing is, we have sort of psychedelic practices that are opening up, mostly like ketamine practices that are opening up. I'd love to start seeing psychedelic programs developing from within, sort of like hospital settings, from within community mental health settings. And once those things are like figured out, once it's possible, you might think of some of the end of life research, some things that are happening in hospital settings. And so as we start to see sort of the integration of psychedelic medicine in our existing systems, and certainly we'll have opportunities that have that be a part of our training. So I think that in as time goes on, we'll start seeing more psychedelic medicine in our curriculum, in nursing curriculum. When we do our mental health section, that we're gonna start talking about psychedelics as a huge component of that, and over the next few decades, really starting to take a bigger and bigger chunk of some of the content there, because really we're seeing the potential for a total transformation of the way that we're doing things, not just in healthcare, but really how we're living life. So I feel fairly hopeful that as psychiatric mental health nurse practitioners, we'll have opportunities to explore opportunities to learn about psychedelic medicine.
Yeah. And as one of those people who resides in that musty ivory tower, I want the students who are listening to this to know that the students actually have way more influence over faculty than they realize. a lot of change is led by students, and they may not realize that, because when you're a student, you feel like you don't have very much power, but you actually do. So keep talking about it, keep advocating it for it. So last question. I recently saw this photo essay where a guy had taken pictures of himself when he was younger and photoshopped himself into them as an adult. And it was like, this is like internal family systems in a visual sense, right? And so we often end our interviews by asking this question: if you could go back and give your younger self, either as a nurse or as just a human being spinning around on this planet, a little piece of advice, what would it be?
Keep pushing.
All right. No hesitation there, man.
Keep pushing, right? Yeah. Stay mindful, keep pushing. It's always going to be the challenge. It's always going to be the thing that we're working towards, is getting to the next day, and staying inspired, and and also recognizing that I think so many people who get connected to the psychedelic world, it makes so much sense, and it's really beautiful, want a change in the world, and realizing that change really has to come from internally first, right? Like, we have to not just push for a different world, with the potential that psychedelics are going to be integral in that, but changing for a different version of ourselves, or pushing towards a different version of ourselves that can really allow that transformation that's happening to be, again, bi-directional with us, with our communities, with our environments. So I would go back and just say, it's going to be difficult, but hey, keep pushing.
All right, Dr. Kwasi Adusei, you have been an inspiration to many today, I have no doubt, and I'm so glad that we were able to get you here on our interview. I hope you tune in next month. We'll have another in this ongoing series of interviews, of psychedelic chats with luminaries in our field and beyond. So thanks for being with us tonight. Thanks, Kwasi. Really appreciate it.
Thank you.
All right. Have a good night, everyone.